everybody, this is Dr. Doug, and we're here to continue our conversation about what is LGBTQIA++ affirmative therapy. We're going to start by talking about the groundbreaking 2000 American Psychological Association ethical guidelines for the treatment of LGBT clients in 2000. Eventually, they include trans clients and gender variant clients too. But I want to talk about the basic guidelines because they're actually very interesting and are still formative. There are 4 categories. The first one has to do with the therapist's attitudes towards gender diversity and sexual orientation. Number 1, we must never confuse homosexuality, bisexuality, and gender diversity with any form of mental illness. We are decoupling innate, beautiful forms of sexual expression and being gendered differently from any type of trauma or mental illness. A big breakthrough. Step number 2 is the therapists need to take much greater responsibility for their own internal bias. They may have inherited. I don't care if you're a queer therapist. All of us are raised in this culture and have been totally toxified by heteronormative, cis-sexist ways of thinking. So our role as therapists is to take responsibility for that. Attitude number 3 is to be aware of the fact that our clients are influenced by a great deal of social stigma and minority stress and are coming in with illnesses that may not be depression as such. It may be because of the oppression they've received for being different. Attitude number 4 is to be aware that many of our clients present themselves as LGBTQIA in a distorted way based on how they've been taught to think about it. So therapists need to be aware of that. Those are the 4 first attitudes. The next big category has to do with relationships and families. LGBT affirmative therapists need to be aware that our queer clients make families in their own unique way and what that entails. Attitude number 2 is that many times LGBTQ people make families that are not necessarily biological. They're chosen, and there may be multiple different kinds of chosen families. The next attitude has to do with the particular challenges facing LGBTQ families, including that of gay and lesbian and bisexual and transgender parents. What does it mean to be a gay dad? For example, that's going to be a heck of a lot different than being a straight dad. And the last attitude is to understand deeply the impact on the family of origin, being gay, lesbian, transgender, bi, etc., has on the family of origin. Is the family of origin accepting? Are they not accepting? Those are very important ways for the therapist to be aware of the different ways our queer clients make families. The next important category in the ethical guidelines for the treatment of LGBT clients has to do with issues related to diversity. It's very important to realize that many of our queer clients also come from communities of colors and are facing interlocking minority stress issues related to being queer and a person of color. It's very important to understand that. Another big important diversity issue is to understand what it means to be a youth who's queer. That's a very different issue for therapists to be aware of than our youths who are heteronormative or hetero. Another important category has to do with dealing with issues related to youth. Therapists need to be aware that our queer youths are going to be dealing with different stressors and different opportunities and different dating issues than our non-queer youths who are maybe more heterosexual. Another important issue to keep in mind is the unique issues facing bisexual clients. Sometimes bisexual clients don't feel accepted in the heteronormative community, and sometimes they don't feel accepted in the gay and lesbian community. Many other issues related to bisexual diversity, very important that the therapist is aware of these. And finally, issues related to aging. Our queer clients face unique challenges and opportunities when it comes to growing old. Sometimes they don't have children because they didn't have the ability to do that. So they might grow old in a very different way. Very important for clinicians to educate themselves, to get training on how to work with our queer clients who are aging. The last important category of the American Psychological Associations for the Ethical Treatment of LGBT clients, promulgated in 2000, have to do with education. Psychologists and treaters need to support the provision of education for everyone to learn more about how to work with LGBTQIA clients. Additionally, psychologists and treaters need to understand how to get more training in these areas, how to be continually increasing our knowledge base and our depth of understanding all the different issues that relate uniquely to this unique population. And most of all, it's very important education-wise for psychologists and treaters and therapists to become familiar with different kinds of LGBTQ people so they don't have to become educated by their own clients. They make it part of their educational training that they get to know these communities of diversity more, so they have much stronger knowledge base in their bodies and their hearts of these communities that are unique and diverse. That's the basic summary of these important 16 guidelines for the treatment of LGBT clients promulgated by the American Association in 2000. I hope you enjoyed listening to these, and don't forget, if you have further questions, to ask Dr. Doug.